meeting of the Human Services Committee today. Thank you for being here. Item 2 is the approval of the agenda. The Chair will entertain a motion to approve the agenda. So moved. Thank you. Moved by Commissioner Williams, supported by Commissioner Bear. All in favor will please say aye. Aye. Any opposed? Thank you. We're up to public comment. This is the part of the committee where we have public comment. Please approach the podium and let us know your thoughts. Thank you, Harry.
Hi, I'm Harry Wilson. I'm the chair of the Jackson Medical Care Facility Board and also the chair of the Department of Health and Human Services Jackson County Board. And I just wanted to rise to let you know that last week Newsweek magazine rated the Jackson Medical Care Facility number 4 in the state. They rated, I think it was 25 of the largest populated states in the country, and our nursing home was number 4. I've also, Earl has been at all our meetings, and last week he brought up a bunch of questions, and I just wanted to make sure I was here to tell you that we're addressing those questions. He met with people last week and got a lot of those answers, and that next month you'll hear from Destiny, but she's at a national conference right now learning more about financing at the time of COVID. So I just wanted to pass this out to you, and I'm done.
And so Commissioner Williams and Commissioner Snell and Commissioner Bear is a member of our committee too. Thanks, Harry. Sure, let's do that. Chair will entertain a motion to accept the handout from Harry.
So moved.
Support. Thank you, Commissioner Snell. Support with Commissioner Williams. All in favor of accepting Harry's report will please say aye. Aye. Any opposed? Thank you. Appreciate you being here today, Harry. Thank you. Any other public comment? Any other public comment? Public comments are now closed. Now we'll move on to item 4A, approval of the minutes of last month's meeting. Chair will entertain motion. Commissioner Snell and support by Commissioner Bear. Thank you. Any discussion concerning last month's minutes? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. We are up to now to Lifeway's report. Understand that Director Leonard is not going to be here today. Her report is before you. Give members just a moment to take a look, and please advise any questions you may have concerning Lifeway's report. I will make note of the ribbon cutting last week for the new building there, and they've done a nice job. I recall seeing Commissioner Snell and Commissioner Shotwell there. Any comments on Lifeway's report? Chair will entertain a motion to accept the report.
So moved.
Thank you, Commissioner Snell, and support by Commissioner Williams. All in favor will please say aye.
Aye.
Aye. Any opposed? Thank you. And now the Region 2 Area Agency on Aging. Good afternoon. Thanks for being here today.
Good afternoon, Commissioners. Nice to be here today in person with the pandemic. I know the last one I wasn't here in person, but I appreciate your support in that decision. You have a report in front of you for the Region 2 Area Agency on Aging. And just a reminder for those of you that may not remember, we do serve Jackson, Hillsdale, and Lenawee counties is our region of the state. And so the report represents funding for fiscal year 21 through August 31st, and that's the last reporting we had available for this report. And a reminder also is that our Medicare Medicaid assistance program funding is dispersed at different intervals throughout the year, so it doesn't tie to our fiscal year. And the report also shows impact in Jackson County through the Area Agency on Aging with the first Coronavirus Response Act and the CARES Act nutrition service allocations. Those are mostly one-time funding allocations that help support seniors and adults with disabilities in our community throughout the pandemic. So those were very impactful in Jackson County. You'll see at the bottom of the report some of the numbers about those that we serve from Jackson County. And just so you know, we did see during the pandemic an increase in calls to our organization, and we did not close during the pandemic. We were still open. We limited visitors to our building, but when folks would call us, they still spoke to a live staff member, and we could still help make sure services were provided in our community. An advocacy update. We continue to work with our association partners and fellow aging providers to advocate on behalf of the needs of older adults and adults with disabilities in our state, and also with federal legislators. In May, we successfully hosted at the Area Agency on Aging our first virtual town hall with 5 of the 6 of our state legislators in attendance, and we look forward to hosting another town hall in the spring. Most recently, we have been working with other area agencies on aging around the state to educate legislators about the importance of home and community-based services during this pandemic. It really has been important to allow seniors and adults with disabilities to stay in their home and receive services there, as an alternative to going to a nursing home or another facility. And we're also asking for support from the legislators, so it's just kind of a little shout out if you happen to be talking to the legislators from our region to remind them for the American Rescue Act funding. We need support to do a match of dollars for those funds to be allocated to the area agencies on aging around the state, and that would be very impactful for the counties we serve as well. Something of interest that's happening this Friday is there's a Michigan Commission on Services to the Aging, and they're visiting Region 2 this year. And so on Friday they're holding their meeting at the Holiday Inn in Jackson, just there off Airport Road, and there will be a public hearing at 1 o'clock. So if any of you are available, we of course encourage you to come and share your thoughts about what needs you see for seniors in our community at that meeting. And it's the first time I remember the commission coming to Region 2, so it is exciting that they're going to meet here. Our Medicare, Medicaid open enrollment season begins on October 15th and runs through December 7th. So we affectionately call it MAP, but it's Medicare Medicaid Assistance Program. And each year, those on Medicare have the opportunity to revisit their Part D plans and see what makes the most sense for them based on the prescriptions that they may take. And it's always wise for older adults to revisit their plan because it can change from year to year. So we do offer appointments at Region 2 Area Agency on Aging, but there's also appointments available through the Jackson Department on Aging and the other departments on aging in the other 2 counties. So it's a good reminder if you have friends or family that this would be helpful for. And we're at Region 2, we're offering the appointments in person or over the phone or via Zoom, so whatever folks feel comfortable with, we can make that happen. Also, we're starting our work on our Holidays at Home campaign, and this is a program that we do each year where we collect donations from the community to purchase a small gift over the holidays for some of our most vulnerable clients, and it usually includes things like blankets and some things like that folks will need. And so we're starting our campaign because we can't use our grant-funded monies for that, so we do collect donations, and then anything we have extra we use for an unmet needs fund that we use throughout the year in case we get calls for things like, somebody's run out of fuel oil or they need help with a prescription or something like that. Our Friendly Reassurance program continues continues to see an increase in participation from those in the community, and it really addresses social isolation with older adults and adults with disabilities. And we're always looking for volunteers. We've really relied on volunteers and interns that we work with to support this program. So if you have anybody that's in your life that may be willing to volunteer, please have them reach out to us. As far as the COVID-19 update, you know, the AAAs around the state, including Region 2, has been asked to help facilitate the third dose and booster shots for small congregate facilities. And there's approximately 100 facilities in Hillsdale, Jackson, and Lenawee counties that we're assisting residents. If they want to get the vaccine, they can reach out to us, and we're contacting the facilities directly to see if they have folks, and we can help arrange transportation if somebody is interested in the vaccine. We're also working on options with a local pharmacy where we can go out to someone's home if they're not able to travel. So all of that, please call the agency if you have someone that needs help with the vaccine. We're still working, you know, on reports to the state of Michigan each month. We have to report any positive cases that we see in those we serve, and that happens monthly. But just a reminder that, you know, our doors are open at Region 2 Area Agency on Aging. We are seeing visitors again in the office, and we are able to help with information referral and map appointments or whatever resources folks need. So we also have, you know, there for a time we were advised not to do in-person visits in the home for those we serve, but we are considering those on an as-needed basis for those that really need our help. Something else that's, you know, been big at the Area Agency on Aging over the last year and a half is our board is working on designing and eventually building a new building for the Area Agency on Aging. We were lucky enough to get a donation of some property that was near us from Dr. Cole and his wife in Brooklyn, and the board is actively working to redesign a building that will better serve our community, including all 3 counties there in Brooklyn. I do want to say a big shout out to Danielle and the Jackson Department on Aging for really working closely with us during this pandemic. It has taken all of us to work together and be innovative and making sure our services are still getting out where they need it, and Danielle was a great partner for us. And I also want to thank Tony Baer for his services on our board. Like many of you probably know that he's an architect, and so what a better time to have him on our board helping with a new building project. So we thank Tony for his service. Any questions for me?
Questions for Region 2? Okay. As a newly qualified Medicare recipient, I guess I'm kind of curious to know what sort of services you provide to people who are Medicare and or Medicaid, well, I'll just say or Medicaid eligible.
Well, for folks that are newly eligible for Medicare, you are welcome to call us or the Department on Aging, and we help folks, you know, learn about it, find out what their options are, help them make their selections. We're unbiased. We're not working for an insurance company, so we offer many options, and then help somebody sort through those. So, you know, it can be very confusing, all the mail people get, so we help with that. And then each year, you know, at this time of year, we're helping with the Part D selection, because you can change that each year, and this is the open enrollment time for that. So we actually sit down, there's a computer program we use, people bring in their list of medications, and we enter them in and see what comes out that's going to, you know, be most cost effective for them to cover what medications they take.
Very good. Any questions, any further questions for Region 2? Okay, thank you.
Thank you.
Appreciate the report today. Next, we'll move on to a resolution related to the maintenance of effort for the medical care facility. Do we have any presentation on that, Mr. Overton or Ms. Kubitsky? Anything particularly? Okay. So members will have seen the staff report This is related to the usage by the county, basically, of some of the MOE dollars, if I'm right, to make the bond payment related to the MCF, and then also some retiree health costs that are coming out of the MOE to the county general fund. And so the action we need to take here, I'm going to look to administration to make sure I get this right, is to recommend approval of the full board of the adoption of this resolution. Is that correct? Okay, very good. Thank you. Commissioner Bear moves and Commissioner Snell supports. Any more questions related to the resolution? Everybody understands what it's up to, okay? All in favor, do you want to, I was just going to say, let's do a voice vote. All in favor will please say aye. Aye. Any opposed? Thank you. I guess at this stage of the meeting, I will make note of the fact that thanks to Chair Harry Wilson coming up today to talk about the MCF, I have had some questions to the MCF related to how its financial sustainability. Had an excellent conversation with the director and the Lally Group last week. They were excellent and provided some good information. Meanwhile, Destiny has provided some background information about maintenance of effort generally. And I think commissioners will have seen an email about that either you've already gotten it or it will be along shortly. I would ask commissioners to take a look at that in advance of next month's meeting, where we'll have a greater discussion related to the medical care facility and how we can help it keep it self-sustained, and to understand the county's responsibility in maintaining the medical care facility. Now we're up to the Department on Aging's monthly report. And there is Danielle. Always good to see you.
Good afternoon. Of course, we had our shred day back in September. I just wanted to provide some information about that. And of course, that was a grant that we had received with Region 2. And I'd like to, again, just mention, they mentioned our great partnership during the pandemic. And Nicole was fabulous to work with, just generating ideas on how we could spend out our grants. So just wanted to comment on that. But we actually had 37 people attend our shred event, and we disposed of over 2,000 pounds of materials. And so I thought that was a pretty good number for a 2-hour event. It was our first time doing something like this in the community. Individuals that went through the drive-through for that filled out a survey, and we had 30% report that they had been victim of a scam. Often at times people kind of underreport when they've been victimized, so we assume that number could be even a little bit higher than that, so we thought that was a pretty high statistic. Again, that could be related to a phone scam that they got involved in, mail scam. There's a variety of different things out there. Our biggest way that we found out that we were reaching people about the event was our senior circuit. We did some paid advertisement through JTV as well as the Exponent with the grant that we had, but overwhelmingly it was like our senior circuit seems to be our biggest outreach in order to engage with the community. It seems to pop up like that in all of our surveys, so again, that's a very good tool to educate the seniors that we work with and the public about upcoming events or any kind of big needs in the community. We use that a lot when there was early on of the pandemic, when there were shots available. So using that as an outreach tool is good for the Department on Aging and can also support other departments that we work with. 100% of the people, again, reported that they would participate in this type of event again. So hopefully it's something that we can make available on a yearly basis, and just, again, help to make that resource available for people to dispose of their property. We did a home care survey in September with our advisory council. It's a great way for the advisory members to get a chance to talk with clients and ask some questions about the programs. In our home care survey, this is for people that might go in under, again, to clean the homes as well as also to provide bathing assistance. So some of the things that that I thought were valuable that the advisory members gathered were that 100% people found it to be helpful, and it helps them to remain in their homes. So it's, again, a valuable service that supports them. Also, I think it's important that 100% people felt that we notify them when there's changes. And so it's a great time for us to engage with the seniors if there's things that need to be changed on a schedule, especially during the pandemic, if there was times where a worker got quarantined or things like that, that we're communicating with our clients about the changes so that we can either get something rescheduled, replace a worker that's coming. And so again, when we get that 100% back, that they feel like we're communicating with them with the changes, that's very important with our services. One of the comments that somebody had mentioned was the last one regarding a change in the housekeeper that was made. Again, they were satisfied and everything was all right now. Sometimes when you assign a homemaker, you can always have different personalities or things like that. And so we always want our clients to look forward to that visit occurring. If somebody's ever don't feel like they're just, clicking personality-wise with a worker, we'll make those changes because we want them to look forward to that visit, to feel supported by that worker and our agency. So again, we make that available to make any kind of changes that are necessary. An update on the Meals on Wheels van. I previously came to the committee and talked about the donation from the Friends of Jackson Seniors, and I wanted to let you guys know that the Friends of Jackson Seniors had met in September, and they actually changed the amount that they wanted to put towards the vehicle and actually cover the full percentage of that Meals on Wheels van. It's been a goal of some of the members to actually pay for a full van, the full cost of that. And they had some donations that came in, and they felt that the time was right for them to go ahead and commit to the full dollar award for a van. So it is still coming out of our trust and agency account. So it's still the same line item that's paying for the vehicle, but now we don't have to use some of our other donated dollars. We can actually save those for another unexpected item that may come up that we may need to use those dollars for. So again, we're thankful to the Friends of Jackson Seniors. At the end of the year, usually in September, we will get something from Region 2 that may allow for some extra grant dollars that come in at the end of the year. So there was some increase in nutrition dollars that we recently found out about. So we received an additional $2,116, kind of broke down into a few different funding sources. But these are dollars that I just wanted to let you know that came available, and we'll incorporate those into our budgets. I also highlighted a letter that we got from the senior for the Moment of Excellence, and this letter came in from a recipient of our chore program. She had to have a window fixed in her trailer, and we often find that there's not a lot of people that like to go in and do work on trailers. Even some of our contractors, there's only one that will do that. And so he was able to go ahead and fix the window that was causing some damage with the rain coming in through that. So this was able to improve her home environment, and she was very pleased and excited that this was able to be done for her. So I just wanted to share her letter of gratitude. Any questions?
Okay, questions from members? Not seeing any. We appreciate the work you're doing. Thanks, Danielle.
All right, thank you.
And now the Health Department monthly report. Kristen, how are you today?
Kristen's going to start out the report. Well, actually, Kristen's going to do the report, but I just wanted to start out by saying that Kristen's been in the deputy position for about 6 weeks now. I think it's been approximately 6 or 7 weeks. and she's doing phenomenal. She's doing a great job, jumped in with both feet. She's putting in a lot of extra hours to get acclimated and to learn the position and learn the people at the health department. And so I just wanted to give her some positive feedback and some accolades for all the hard work that she's putting in. We're getting phenomenal feedback from the staff as well, how appreciative they are that we're available to them, and that they have a person available to come talk to or to share concerns with. So, like I said, just Kristen's doing a phenomenal job, and I just wanted to thank her for that.
Thank you, Deborah. Good afternoon. I keep wanting to say morning. I always feel like it's morning when I'm here. I have the traditional health department update in here. It kind of follows the same organization that it always has. What I want to kind of gloss over is a lot of the COVID stuff, because we talk a lot about that, but talk about back to other regular operations. So just, highlighting some of the other things and other good things that are going on in the health department. Starting with WIC, I'm happy to announce this first paragraph has actually changed since September 28th when we reported it, and talking about difficulty filling positions, which I know we're seeing in all areas of the county and other businesses. But the second bullet on there that talks about 3 positions, the full-time administrative clerk, nutritionist, and part-time clerk. I know they've extended an offer for the nutritionist, and I believe the full-time clerk, and I believe they saw resumes and did interviews last week for the part-time position, and I think they found one. So I believe that will put WIC fully staffed, which is good, because you can see on their numbers in the next page that their numbers are higher than our normal caseload, or a couple hundred higher there. And then just to highlight the Project Fresh, that is a program that WIC clients can receive or can purchase food from local farmers. It actually runs till the end of October, where they can actually purchase the food, but they can, their cards and everything, I believe, have been handed out. But so it's primarily a summer program where we hand those cards out. But that was, a huge success. They did it remotely. Not remotely, they did it by car, by drive-up car, where they could come in and get theirs. But clients are now coming into the building, and through November, I believe we have the ability to do telehealth and virtual with them, and that's part of the state and federal guidelines. The next one to highlight is the Marijuana Oversight Grant. This one is, the grant has actually ended. It's a 9-month grant, and then it restarts in January, kind of an odd cycle, but just to highlight that we've given out the lock bags for marijuana. We know marijuana and the dispensaries are popping up all over the county. So as the health department and using this oversight grant, where can we educate and keep the marijuana out of hands where it's not supposed to be? So, and they are also focusing a lot now, or they had been putting an emphasis on, pregnancy and the marijuana and that effect in the home. Empowering Youth Today, another youth program, kind of kicks up and in full swing when school starts. That's on there. We have programs that started in August and September. Teen Outreach Program and our Teen Pregnancy Prevention Coordinator is a position that has been open for a while. We do have some classes that can start within the schools. We had the Pathways, and I think another one of the alternative schools, the Jackson Pathways for Jackson Public, and another alternative school, really looking to get that program back, because it works with their at-risk youth and puts positive, peers and people in place to help facilitate, the at-risk students. But we did extend an offer to a new teen pregnancy prevention coordinator who is coming from West Virginia or Virginia, so she should start in November. The lead outreach program, that has been renewed for another year. Our fiscal year ended, just to know, our fiscal year ended with all of the state funding, ended in the end of September. So we were again approved for part-time, $40,000, 10 hours of lead outreach programming that will start up again with this new grant cycle. And again, hearing and vision. hearing and vision within the schools, the technicians there are at full force, minus a part-time person that they have doing that. They, with the COVID and restrictions getting into the schools last year, they were not able to see a lot of the people that they needed to see, specifically Head Start students, and then every other, they have mandates on how many children they have to see and how often the children have to be tested for a vision or hearing screening. And so now all of the schools are ready for them to be back in the school and doing these, and they are working gung-ho to get kids tested. The next page on there just talks about the WIC numbers. You can see that if you'd want. Moving to the personal and preventative health services. This is our primary department that works with most things COVID-related. So as I said, there's several pages of COVID numbers and COVID graphs and things like that. All I'll really say about COVID is that we have seen, some increase, as would be expected with schools starting, kind of everything picking up in a back to normal basis. So, we've seen some small increases in our numbers on a slow trajectory up, but it's nothing that we are, I don't want to say we're not concerned about it, but it's nothing that nothing that we wouldn't expect. Two other things that are big and happening in the news of COVID are the booster and the third dose. The Jackson County Health Department has those available Monday, Tuesday, Thursday, Friday. Our immunization clinic is open and has those available for anyone who meets those criteria for those doses, and as well as first and second shot doses. Communicable disease, so again, that's where a lot of time is spent with COVID, but it's, we wouldn't want to miss that there are other things that are being evaluated and responded to. There have been 38 cases of foodborne illnesses investigated this year, 14 cases of salmonella, 14 cases of Campylobacter, and then we also had 4 cases of Lyme disease over the summer. There's a specific incident note on there talking about a family that was exposed to a rabid bat. And so that was the second bat that was positive for rabies this year. So we are monitoring them. There's a couple notes under the community health update. What I would like to mention on that, you see that lead is 0, and I'll point out to why lead is 0. Lead is 0 because we are not able to test for lead right now. The lead 2, I think they're called, I don't know exactly the name of them, but the test kits have been recalled. And so we have no test kits available to actually do the testing for lead right now, and that's a problem everywhere right now. I mentioned the COVID and vaccines already. Then environmental health. Environmental health is still on a path with the inspections and well inspections and wastewater inspections. The numbers there indicate that those are going up and have been up for the second year in a row. Last month, the end of September, we had our first case of an arbovirus. So we had the West Nile virus. There was a press release that went out. We have no human indication of that, but it was, I'm not even sure, Don might be able to mention, but exactly where in the county it was found. And then the last thing that I'll mention on that is the mosquito surveillance program is wrapping up, or has wrapped up, and they're done with that. And I think that kind of highlights, I really wanted to, mention the other, all of the kind of business as usual or business that is picking back up, things that are going back on over there. So, any questions?
Questions from members for the Health Department? Commissioner Williams, please.
Thank you. I just have maybe just one or two questions. My first question is on the Teen Outreach Prevention Initiative. Is that position a part-time position?
No, we have a full-time, it's the Teen Pregnancy Prevention Coordinator. It is a bachelor's degree in health education, preferably in sexual health, child or teen, adolescent sexual health experience. But we actually had to go out, we've had a couple offers that we've placed, but we had to go out and seek additional resumes a couple times now to find someone.
Okay. Then I did have one other question. I won't hold the clock here. I did have one other question as I was reviewing the notes, but unfortunately I did not write it down.
Okay.
So I'll
Well,
get
feel
back
free
to
to
you
reach
on
out
that.
and-
Yeah. So I'll get back to you on that.
Okay.
Sorry about that.
That's
Thank you.
okay.
Yeah, I hope members always know that they can check with their health department and get any questions answered if they need to. Commissioner Bear, please.
Good afternoon, Kristen. What treatment protocols do you offer when this family is exposed to a rabid bat?
I honestly can tell you, I don't know the specific protocols. They work with the Director of Preventative and Personal Health. That department and the communicable diseases nurses would work with the hospital or any healthcare provider but I don't know the specific. I could find out for you. But we don't do treatment per se, so that they would probably do more recommendations and monitoring, working with healthcare providers.
Thank you.
And I believe there's a series of shots they have to take for exposure to rabies, potential exposure, so there's a series of shots. But we don't do those.
So the exposure would be like if someone was actually bitten and
Could be,
at
or
risk-
the bat
at
was
risk
found.
for rabies.
Yeah, or the bat was found like in their home or in their vicinity.
Okay.
If it was found and say dead, then they would test that.
So they would test the bat, but then do they test the people to know whether that's what you don't, not sure.
Yeah, I don't know the specific protocols, but,
Because the series of
guess
shots
it's-
used to be a
yeah.
horrible
And I
thing.
think it's still I could definitely get you more information on it, but I do think it's not something that's taken lightly, or it's something
Right.
that's like light and
Right.
easy for the family that's exposed, so.
Mr. Chair, please.
The process is to capture the bat and titer it. Find out if it has the rabies virus, and hold the bat in a live state until such time, because they are considered threatened or endangered. The bat could be. So typically, they are stored either in Lansing or at the Detroit Zoological Center. And there was a family a year ago in Calhoun County who 3 or 4 of them were bitten because they were thinking the bat was a pet. And so the routine is to check, make sure the bat is rabid. If it is not active, then you don't have to go through the series of shots. But if the bat is active, then yes, you can get up to 10 rabies shots for preventive treatment of it.
Thank you, Mr. Chair. And Commissioner Bear, please.
Well, I asked about the rabid bat treatment. I know the treatment in this country is a whole series of shots that are painful. Other countries throughout the world have a different type of treatment that they have the same or higher success rate with, and it involves ozone. The rabies virus can't live in a highly oxygenated environment. So there's a simple procedure of take a pint of blood out of the patient, take medical grade oxygen, run it through an ozone generator, put the ozone in with the blood, and put it right back into the patient. The highly oxygenated blood kills the virus. So I was just curious whether the treatment that is used commonly around Europe, Asia, other countries, if that's ever been used in well, I guess I know people that have had that treatment, so I know it has sometimes been used. I was just curious as to the prevalence of that type of treatment.
Yeah, and I would just respond to that to say that the medical procedure part of that is not where the health department lies in our role in that. It is much more of the monitoring of the bat and the monitoring of the people and keeping track of that communicable disease and, where, if it was some other kind of disease, but where that has spread and who else might be. So I have no idea if that treatment is done anywhere else.
I'm looking at the CDC website, and it doesn't offer any treatment that what you're explaining, Tony. It just says a series of 4 1-milliliter doses of vaccine should be administered intramuscularly to previously unvaccinated persons. So it doesn't reference anything about what you were suggesting, so I'm going to guess the standard practice throughout the United States would be this series of shots, because it doesn't say anything about that on the CDC.
Okay, well, thank you, Kristen, for your presentation. Appreciate it very much. Now moving on to other business, the chair will entertain a motion to pay the claims. Moved by Commissioner Snell, supported by Commissioner Mahoney. Thank you. Any questions on the claims? All in favor will please say aye. Aye. Any opposed? Thank you. Other minutes, we don't have anything there. Take note, please, of the November reporting schedule, the Department on Aging, the Health Department, Lifeways, and the Medical Examiner, and we will also be hearing from the Medical Care Facility next month when Director Wilkins returns. We're now up to public comment. Any public comment? Any public comment? Okay, public comment is now closed, and now committee member comments. Seeing no hue and cry for committee member comments, Chair will entertain a motion to adjourn. Thank you. Support. And all in favor will please say aye. Aye. Any opposed? Thank you. We stand adjourned.